Welcome to the Sunstone Health Podcast, hosted by storyteller Justin Starbird and Josh Resnikoff, co-founder and CEO of TMA Precision Health. This podcast brings you inside the movement that's reshaping how we diagnose, treat, and care for patients who have spent years searching for answers. At the heart of it all, TMA's mission is to end the diagnostic odyssey through AI, data-driven insights, and expert human guidance. Here are your hosts, Josh Resnikoff and Justin Starbird.
Welcome back to the Sunstone Health Podcast. Today is exciting because we're here to share a story that's at the heart of our mission. I'm your host, Justin Starbird, and as always with me, the CEO of TMA Precision Health, Josh Resnikoff. Josh, great to see you, buddy.
Yeah, great to see you too.
We have a special guest. I'll let you do the honors of introducing who we have with us today.
Yeah, I'm super excited. Obviously, this is a guy who's become a good friend of mine over the last year or so. Brad Levy is the co-founder of Sophie's Journey, which puts on Epilepsy Awareness Day, which TMA is going out to next month. And we were just really excited to be able to bring him onto the podcast and hear his story and just learn more about it and just really support the mission in any way we could. So, Brad, do you want to give a little background on yourself and we can kind of just kick it off?
Sure, thanks. So I am Brad Levy. My family started Sophie's Journey 14 years ago. This was our way of giving back to the epilepsy community after our daughter Sophie had successful brain surgery at UCLA. Sophie was having seizures almost every day for about 5 years. They figured out that the root cause was a big lesion on her left temporal region. So an amazing man, Dr. Gary Mathern at UCLA, went in there and scooped out that little troublemaker, as he called it. And she became seizure-free from that day on. We just hit the 17-year mark on that, so pretty amazing. A few years after that, we were having our annual celebratory dinner with Dr. Mathern. And he said, I think you guys need to come up with a way to give back to the community. How about putting together a patient advocacy event? And let's, try to get some advocacy and some networking done so these families can get some hope and hopefully find a better path. So I went to work and tried to figure out how exactly that was going to work. And I came across somebody who was in the finance department at Disneyland, and she had just had some successful recovery with her son who had epilepsy. And I asked her if there was any way we could have some type of a get-together at Disneyland. And she said, let me go back to the office and see what I can do. And about a week later, I got a call from a senior salesperson at Disneyland Resorts telling me that Jennifer had reached out and they want to help us put on an epilepsy event there. So we had no experience and weren't really sure what to do. We ended up buying a bunch of tickets and reselling them on our website just for the purpose of ease, or on our Facebook, actually. And that first year, we had 875 people show up to Disneyland.
Wow.
Yeah.
And how long has that been going on for now?
What's that?
How long have you been doing that for now?
This will be year 13. We're doing our 13th annual next month in November.
And how many people are you expecting this year?
We're looking at 6,000. I mean, last year I had 5,700 guests. It's kind of crazy. I don't know how we got there, but we're there. That first year was an amazing day at Disneyland. We were crying all day. We made a lot of lifelong friends. A lot of people met others, and we could see that hope element that the doctor was hoping for himself. And we were really encouraged. By the end of the day, 4 or 5 o'clock was rolling around. We were exhausted. My wife and I were getting ready to make our way out of the park and sneak off and go home and get some rest. And somebody came up and introduced themselves to me and commended us on gathering all these people and told us what a great job we did of getting the epilepsy community to come out and celebrate that day. And as soon as I was taking those accolades from her, she turned around and said, but you totally blew it on the educational component. And these people are all going home with no takeaway. So they're having a great day today, but tomorrow they'll be at home with seizures and they haven't really advanced their care or their journey. And that kind of took the wind out of my sail. And then she went on to introduce herself and said, I'm Dr. Deborah Holder. I just moved to Southern California. I'm taking over as the chief of the epilepsy department at our local children's hospital. And she offered to help me put together an education expo for that next year. And that's what we started with. So the next year, we took a small hotel at Disneyland near the property and rented out the little basement conference room. And we had maybe 500 people show up for a conference. We had 4 doctors come and give talks. And we could see we were on to something, but it wasn't super impressive that first year. And last year, skip ahead 12 years, we had 35 hospitals, over 100 vendors, and 5,700 guests show up to the Disneyland Hotel over the 2-day span. So we think we're on to something now, and we're really excited. This year I have 42 hospitals participating, amazing presentations on everything from the basics as far as, your first seizure, epilepsy 101, what do I do now? All the way to advanced care for rare genetic epilepsies and looking at stem cell therapy, RNA, gene therapy. Every new pharma product is there with clinical trial information. It's become a pretty advanced and in-depth education event.
And I mean, it's absolutely unbelievable. I can't believe how much you've been able to grow in 12 years. I mean, like anybody would feel absolutely amazing about that. There's a couple things I recall that you've told me about how you only let certain people speak to the patients to make sure it's worth the patient's time, right?
Yeah, I get some flack for that. We kind of have an unwritten policy, but for the most part, there are 72 hours for presentation, 72 slots in the speaker rooms. And I've got over 200 doctors on the floor now, or 200 providers. So for the most part, we don't have general neurologists. We only opt for epileptologists, epilepsy-trained neurosurgeons, ketogenic diet specialists trained in epilepsy, nurse practitioners working at a high level in epilepsy centers, level 4 epilepsy centers. So everybody is very experienced and has a lot of epilepsy training. There are no basic doctors, newcomers. We just don't have time for it. I don't have space. And I can't take the chance that they are going to deliver inaccurate information. And it's unfortunate that this epilepsy world has become so, I don't know if I can use the word fine-tuned, but it is very micro-sensitive and very compartmentalized now. There are so many genetic components. Surgery has turned into a huge piece. There are multiple opportunities for neuromodulation, different types of implants now that work to break up seizures. So it's a very high level programming with, high level education component. I've got to have the top docs doing those talks.
Yeah.
Are all those talks recorded now? Like, what do you do with the content afterwards?
We do. We actually record all those talks, and this will be the first year that we're going to have an actual production team edit in the slides that the doctors are presenting. We've always put the talks up. I have about 300 talks on our YouTube page, which is linked to our homepage at epilepsyawarenessday.org. And those talks are great. You're getting great information from some, the nation's best docs. But we never really understood the need for the higher level of media, of media content. So we have a real production team now. So like I said, they're going to edit in the slides. We've got some doctors, 2 camera shoot for each speaker. So it's going to look more like a professional medical conference and not like the mom and pop shop that my wife and I have been running, for 13 years. We do the best we can. We have a team of 3.
But Brett, I mean, I think it's amazing that you get to formalize things a little bit, but I know just in my own journey in my space, right, which is not like we help kids with epilepsy now, but I started in a periodic fever, an autoimmune issue. But I have found that sort of mom and pop aspect, that ability to walk the walk, because, and talk the talk, like that has allowed me to have conversations with you that I don't think, if it was too formal or too structured, I don't know it would work so well.
Yeah, that could be. And I don't want it too structured. And, we have AES, American Epilepsy Society, for the academic piece. I don't need it to look like that. We don't want doctors coming in suit and tie. We want them coming in a purple t-shirt. Right. It's supposed to be fun. We want them to be approachable and show their the human side of an epilepsy surgeon. So we get a lot accomplished at the expo. It is, got an informal aspect to it, but there's nothing informal about the education piece and the presentation. It's all really high level, educational material.
But that's what I mean. I think there's so much power in making it approachable for most people, right? Like you, in the rare disease world, you get mom and dad who are not necessarily technical people, who they're trying to go see Dr. Google from 9 o'clock at night to 3 o'clock in the morning, trying to figure out what the hell's going on with their kid. And I know, that there's such a gatekeeping aspect between those academic medical centers where only the best and brightest get to go, and the people who are living it on a day-to-day basis, who are a lot of times reporting things that are happening and not getting taken seriously when they go in. So I think that breaking down those barriers sometimes is so empowering for the families to be able to go and be seen and be heard and find other people for that community. Like the community aspect to me is one of the things that we are most excited to come out and just be with the people that we help, right? And not, we ship kits to families, we facilitate information to doctors. That's all great. I think we're doing really good work, but I can't tell you how much I'm looking forward to being with the people, right?
Yeah, I can see that. I hear that a lot from people who are coming for the first time. And, some of my sponsors have been there for 13 years now. They've been there from the beginning. And at the same time, they walk away saying, we don't have any event like this ever, that we get this much interaction with the families. And that's who drives this industry. It's not, epilepsy it's a tough one. It is not a definitive, almost never is it a definitive answer, cut and dry, black and white. Two people with exactly the same diagnosis whose EEGs look very similar still don't have exactly the same symptoms, and they won't require, generally they won't require the same treatment. So each patient is completely different. And people don't always get their answers delivered when they go to see their doctor for the 15 or 20 minutes that they're allocated in the doctor's office. So when we bring these doctors out, they already know that they are going to have an immersive education by the patient. And the patient, there's no free time. I tell all my vendors, and I'm telling you, prepare to be hungry, because you don't get a bathroom break or a lunch break. There will be people at your table talking to you the entire 2 days. Yeah. And they're looking for answers. They do go to Dr. Google, and then they show up to our event to either confirm or reject what they saw on Google. And it's just amazing how generous our doctor partners are. They show up, they take 2 days off of clinic, sometimes 3 days off with travel. And they're standing at their table, speaking to families all day, both days, answering questions and reviewing people's cases. And, we encourage families to bring your epilepsy timeline, basically talking about your whole history with epilepsy, as well as, what meds you've taken, what doses, when you changed, all different test results. So people are walking around our event with either a 3-ring binder or a digital format on their phone with all the medical records, all their notes, timelines of seizures, things like that. And the doctors are willing to dig in and read that stuff and try to give them, some suggestions.
So I didn't realize that you had, do you even have a space for like informal consults? Is that how that works? Or is it doctors at tables just waiting.
Doctors are at their hospital tables. So,
Wow.
so yeah, the hospital institutions have tables there, and the doctors will usually be at the table doing meet and greets throughout the days. And, you know, when you are chasing a cure for your sick kid or loved one, HIPAA is just a formality. Nobody is concerned about somebody else hearing their question about their child. It's actually the opposite. People stand up in the presentation, raise their hand, and then just, you know, monologue for 7 minutes, giving their entire timeline on the seizure, on the seizure timeline of their loved one, hoping that the doctor's going to hear something and it's going to click and he's going to make an intervention or make a comment, give some advice that she hadn't heard before from from her doctor or any doctor. And that can change the whole trajectory of your care. So we push for that. And yes, we do have not a private area or a separate area designated for consults, but we often have doctors say, well, Mom, you really did your homework. You're a complicated one. Let's go out there and get a coffee and have a seat at one of the tables out in the lobby and where it's a little quieter and let me really digest this.
Yeah.
Quick follow up to that. You know, when you have so many people that are in attendance, you know, that are fighting this on a day-to-day basis, are there, you have 200 doctors there. Is that even enough? Like, you know, do people, you know, not have the chance to, you know, looking at it from the other perspective?
You know, most of the time they get to talk to the doctor. If they, you know, it's not like they're waiting in line and then the doctor runs out, you know, to go have dinner, like the guy signing autographs at the baseball game who he tells himself, I'm going to sign the first 5 and then I'm walking. These doctors want to help. We have no zeros. They're all heroes. These guys are coming to make a difference for you. And I think that's their juice. That's what they love to do. They know that they are working in a somewhat broken medical system where, you know, insurance payers and the hospital administration are saying, Dr. Resnikoff, you've got 18 minutes for a return to clinic and 38 minutes for a new patient eval. And after that, you need to send in the nurse or the nurse practitioner or an LVN to wrap up that visit and get the refills done, et cetera. You have to go see the next patient. And these doctors can't really do the acute care in 38 or, you know, 18 minutes. So people know that they're coming here to spend time with their doctor and get their questions answered. And for the most part, everybody gets to talk to who they want to talk to. What happens during the course of the year is both my wife and I get emails from strangers saying, yeah, we were just reading on the website and we read some social media posts and it seems like you guys get very involved and try your best to help people find what they need. So I connect with families in advance, try to triage the case as best I can without any formal medical training. I listen to the story. I look at the timeline. I figure out who they're seeing, what meds they've tried, what's worked, what hasn't worked. And then I kind of build them a little itinerary of what they need to do when they come to the expo. So they need to sit in on the clinical trial and research presentation, because if you're hopeless and you're not getting seizure free and you've tried 8 or 10 meds, you definitely need to sit through the clinical trial and research program, because that could be your future cure. So they've got to go in and see that. And then if it's a genetic epilepsy, I mean, I've got the best of the best in genetic epilepsy on the floor. So I'll set them up with talks with some amazing doctors, you know, from the top centers across the country who are leading these clinical trials. And that's kind of how we do it. We basically make little marriages of families and doctors all the time. And the doctors who have learned my MO and know how I work, they plan around that now, and they come prepared with information on how to transfer care, how to fly across country for a second opinion, how to get your insurance to cover such a thing, how to help you get free travel from people like Miracle Flights or Angel Flights, and there's Ronald McDonald House who will, sick kids can stay there for free, and it allows you to fly across the country and visit somebody at a top center when you don't have a top center in town.
Are you at the point where doctors are also hunting you out to not necessarily look for patients, but I can imagine a doctor who maybe is early in their specialty career. You have such a huge network where maybe they're looking for networking the same way that a family is, right? Where they come to see you and say, hey, I've got these issues, right? A doctor says, hey, I've gotten really good at these kind of cases. Is there anyone who needs help? Do you find that conversation happening?
So in the epilepsy world with epileptologists, it doesn't happen as often, but we have a huge crossover population with autism. And my professional practice where I do EEG monitoring for autism and epilepsy, it happens there quite a bit because doctors refer us a patient that is suspected of having seizures, but there is no clinical evidence yet. And we do these overnight EEGs on these patients. And then my epileptologist furnishes a report that says, wait, what? This is like full-blown generalized epilepsy, long time forming generalized epilepsy. How could this patient not be treated or be seeing an epilepsy specialist when the EEG looks so impacted? And when I send those type of reports back to my autism doctors, that's when they scratch their head and they say, oh, I could deal with this if it was a few little absent seizures, but this is pretty intense. Help me out. I need to get them to a center. And then, I'll send the mom a few choices and get her to usually the chief of staff at any major level 4 epilepsy center. The doctors have learned that the month following the expo, prepare for a bunch of referrals from Brad, because that's what happens. Patients go home and then they think about it and they look through their notes and then they'll write me back and say, hey, how do I see Dr. Sankar at UCLA? We'll travel there from Hawaii. And I make it happen.
That's amazing. Can you talk a little bit more about the EEG business that you have and just why it's so important because of how much is missed with the terrible, inadequate, in-office EEG that happens right now? I'll say it out loud.
It's the truth. I mean, most epileptologists will tell you that the routine 40 and 60-minute EEGs are for the most part irrelevant. They generally are used to get you insurance approval for the overnight EEG, which makes no sense because they want that routine EEG to either be abnormal, and now you're going to go back from 3 nights and get more data to track that abnormal, or it was unremarkable and normal, and now they think they missed it, so they still need a 3-day EEG. So I scratch my head and say, why did you order the 1-hour EEG in the first place? In the pediatric world, it's insane. Why is it insane? Because it takes the same amount of time to hook a patient up for a 20-minute EEG as it does for a 24-hour EEG, where you're getting 50 times more data. Why would you not want more data, which is completely, giving you a roadmap of the brain? So, it's troublesome, but, a lot of buildings just don't have the accessibility and can't get overnight EEGs done regularly, so they just do these routine EEGs. We started EEG to go 13 or 14 years ago, coming up on 14 now, because patients who are healthy and have other issues like seizures, anxiety, stress, a compromised immune system, sleep issues, they can't spend 3 nights in the hospital. They'll never sleep. They'll leave in worse shape than when they went in. So we want to be able to hook them up with the same level of, quality of that monitoring and of the recording device. But we want to hook them up, send them home, and have them spend, the next 2 to 3 days at home gathering that data while they are in their natural environment, which is where they're most likely going to have seizure activity or clinical seizures. And it's working. A lot of people do what we do. I don't believe anybody does it the way that I do it. I think they do it for the most part as a revenue stream, and they just want to do it as easy as they can and have the least amount of overhead. And we just don't have that attitude. We're going after the underserved patient, just plain and simple. It's in California, often the underserved is also underinsured.
Yeah.
So it's a lack of access all around, and that's why we do EEG to go. So we want EEG to go to service anybody and everybody. We do work with most major insurance, and we're kind of good-hearted. So when we have an insurance issue and there's no way to get somebody covered, but we're very sure they're having seizures, they're getting pro bono services.
But that like pay it forward mentality, right? I mean, I think so many families would have gotten to the point of their child no longer having seizures and being on the path to being seizure free and relatively normal, and would have just counted their blessings and gone about their business, right? Like this, you really put yourself out there. It's something that I've always been really impressed with you about, not to gush on you, but like, you really are the kind of my gold standard for somebody who does well by doing the right thing, right? And I mean, look at the success that you have with EAD. Like you're about to expand to the East Coast. You've grown this thing, I mean, 10x over the last 10 years, right? Like your EEG business is growing. You're helping people. I mean, that's the kind of work that I want to do, right? That I'm hoping to do and it's the same challenge that we have for the genetics, right? Like you can go through this incremental process of getting a microarray and a single gene and a gene panel and an exome, and it just takes time, and it's a waste of the patient's time because you need the whole amount of data to make an informed decision about what to do. But exactly. I think people like you who've been at it for over a decade, right? You've really blazed the trail in this whole space for, what jumping right to the end can actually do for patient outcomes.
Exactly. I'm trying. That's what we try to do. It's been amazing. It's really, it's very rewarding doing the epilepsy patients and being able to help direct them to a level 4 center. A lot of people come in, with complaints that are not mentioning seizure as one of their issues. They're calling it migraines, ADHD, poor sleep, staring spells, daydreaming. And once we do the EEG and they actually get an epilepsy diagnosis, they're scratching their head thinking, wow, this is not what I thought. But since I'm here, I better keep digging in and see if I can't spread the word. So there's always some of that.
Yeah. And so just how far abroad are people coming now for EAD?
Oh, wow. I've got a family coming from Nigeria, several from the UK, Cyprus, not Cyprus, California, but Cyprus, the country. Yeah, it's going to be crazy. And then I think we have like 36 or 37 states covered. Wow. People coming from 37 states.
It's wild. Yeah.
It's out of control. It really, it is. It's taken on its own life now. I just have to keep up.
Does it ever, does it ever catch you off guard? Like the thing, you push this ball over the edge of the hill and you've seen it take on a life of its own. Like, are you ever amazed by what it's become? Did you ever think it would become this?
Never thought it. And I'm amazed every day. We're so blessed that people, I don't know, these doctors, I don't know how they can just trust me and show up to this event knowing that I'm going to keep them busy and they're going to be able to, do good work. And then they show up and none of us understand how this thing happens every year. We just show up to Disneyland on a Sunday morning and then clap our hands and turn around and the room's built out. It's almost like that. It really is. And I don't know how it got to be there, but we're proud of it. And at the same time, we're surprised.
It's the Disney magic, clearly.
Well, that for sure. There was no doubt that we were on to something selecting Disney from the beginning.
Yeah.
For people who don't really go to the park, like myself and my wife, it's a little harder, but I don't mind.
How do you balance that, or how do the families balance or they work in all that education and then they still want to have a chance to have their child or a little playtime as well, right? I mean, the opportunity to go enjoy themselves, something that they may not have the opportunity to do much otherwise.
Yeah. So there's a lot of opportunity for that as well. They, I'm sorry, I'm so tired from this morning. I had a crazy day at the office. Ask me that question again.
Well, I think but Justin, there's like 2 days of educational program, and then really
Thank you. I'm sorry. I just dazed off for a minute. The expo is 2 days, and then the third day is Disneyland. So if you have older kids, they tend to last until about 2 o'clock, and then they're burnt and they want to go to the park. So we hope the families come for the whole 3 days, and then they can come and see the expo 2 days in a row in the morning and go to the park in the afternoon, and then finish up the park on Wednesday with everybody else when we're all running around in our purple shirts. But the expo is really the important component. Yes, everybody wants to go to Disneyland, and it's been a great, vehicle to get people to come to our event. But this truly will change people's lives. It's not, we're not chasing cancer, which is a real, physical, finite ailment that you can take a picture of, get a perfect diagnosis, and have a plan to treat it. It's not like a broken leg where you're walking around in a cast saying, oh, I already know 4 weeks and 2 days left, 4 weeks and 1 day left, and then the cast comes off. We don't have that in epilepsy. So I think people really come here knowing that they've got to do their work and dig in and spend as much time in the expo as possible, and then go and have that warm and fuzzy on Wednesday.
But honestly, the thing for me that, like, I'm not a Disney guy, but I love the fact that this happens at Disney World, Disneyland, because if it was like the Denver Convention Center, right? Like, maybe there's stuff to do around Denver, but the idea that there's this backdrop, let alone the Magical Kingdom, but that, you have the patient and you have mom and dad. We always talk about them, but the whole family gets affected by a kid with a rare disease, a kid with an epilepsy. Like when you have a sibling who's constantly in and out of the ER, it takes a toll on everyone. Your whole lives end up revolving around the sickness, and giving families even a little bit of reprieve, and like that older sibling or younger sibling, like, hey, we're going to go ride a roller coaster today because we're already here, and you get to go swim in a pool or anything like that. Like, I just think you've done, it's such an amazing job of capturing everything to give families the education that they need to maybe get a path forward that's going to work for them, and a couple of days to just have some fun and be a family together. Like, it is not surprising to me at all that it has become such a huge, impactful event on a yearly basis for these families to come back over and over again.
Thank you. Yeah, we try hard. We really, I think they do get a lot out of it. It's free. And, we've got every top doc there. We're so blessed. These doctors just trust us, and they take days off from work to come to the expo and give talks. Families fly out. They make this their family vacation now. This is their once a year. They come out, they do the expo, and they go to Disneyland for a few days. Some people will go to Legoland or SeaWorld or Universal, an hour in each direction, and they make a week of it in California, and then they head home. But most importantly, they're going home with a bag of tricks on how to make that patient with epilepsy live a better life.
Yeah, it's such a win-win-win. It's amazing. It's amazing.
So you keep. Let me just jump in real quick, because you keep the parents and the kids busy. You keep your doctors busy. How do you? I know Josh is going for TMA Precision Health to be, part of the expo. Talk a little bit about how you vet out, those partners that you bring in, because you mentioned earlier in the episode that you don't want to waste anybody's time. So how did that all come about? Where TMA is now going to be at the event?
Well, it's a real system, and it's a real program, and it's a real product. So this is my sport. I don't watch any professional athletes. I just, compared to epilepsy surgeons, they're way overpaid. I would rather take half that money away from NFL players or NBA players and build more hospitals and give doctors a raise, especially the ones that actually save people. It's making it very hard for them to make a living, believe it or not. So, being that this is my sport, I always look to bring the newest, freshest content. So every new product, any resource, any new drug that people are talking about, that are looking to start, sites for participation for clinical trials, anything new and cutting edge, I chase it down, and I basically, I'm persuasive. I get people to show up to the event, and they almost always have an amazing, outcome and become long-term partners with us. So that's a key piece, is finding the best new products and resources and bringing the best docs and getting them to talk about whatever newest paper they've just come up with, which is, going to, present some data on a clinical trial, most likely. So as far as the vetting process, it's got to be something viable. I always ask some of my top docs, what do you think about this? And I listen to them. And if they, if there's a strong argument against it, we just skip the vendor. I mean, nobody's entitled. Being that, again, it's a team of 3, we're able to keep a really good, control on who attends. And that's the point. I don't need it to look like a swap meet. I don't need people in there selling T-shirts that say, I had brain surgery, I had an EEG to go, and they're just trying, to make money like buying a concert shirt for $40, and it's a $6 printed shirt. So we don't really have folks like that. We look for what's new in the genetic world, what's new in the surgery world, what's new in the pharma world, what's new in any type of a therapy or diagnostic tool, and we want to bring it and be the first ones to show it, which is why we brought Josh out this year. Because
I just remember the first conversation we had when we got introduced. I think it was through Christina Waters, if that's correct, right?
Yeah.
And she was like, hey, I'm working with this group, TMA and Josh, and they're doing, whole genome sequencing and trios for epilepsy. And I'm pretty sure the response I got back from Brad, sight unseen, was anyone who's advancing whole genome sequencing for kids, I will get behind 100%. And then the thing for me was like, I'm passionate about my mission. Obviously, I've brought a lot of people, I've swept a lot of people up, but talking to Brad, like, I want to support Brad's mission. I'm on Brad's team now, not the other way around. So no, 100%. Like
now I'm getting all
when we first started talking, I think our first conversation was supposed to be 20 minutes, and they were on the phone for an hour and a half. And I remember we went pretty broad, pretty deep, but the work that you're doing, I'm super proud to be a part of what you are putting on for these families. That's how I feel, not the other way around. Yeah.
Thank you.
We're gonna be out there in a month and really looking forward to it.
It is yeah. Oh wow. It's a month and I'm scared now. It's a month and 3 days. Yes. Kind of crazy.
It's gonna be great. It's gonna be great.
It is gonna be great. We're very excited, and we're lining up some patients for your program to get them some genetic testing. I just had a patient reach out to me today, someone I know very well. She's in a book that we published a few years ago, stories about epilepsy. And this poor young lady, mom is amazing. She has adopted several kids with rare, complicated genetic disorders over the years. Super lady. After she raised her own children up and sent them out into the world, she didn't want to be home and not have anything to do. So she started rescuing sick kids.
Amazing.
And she's got one daughter that we know very well. I believe she's close to 30. And she's got a very rough bout with epilepsy and is very complicated. And with all the different treatments and surgical options and things that they've done with this young lady over the years, she has never had whole genome sequencing.
It's insane.
I know, but unfortunately, Las Vegas is one of the worst places in America for healthcare, I'm sorry to say. And they cannot get anybody to even listen to mom. So she's been neglected. Well, if we knew what we know now, 15 years ago when I met her, she would be on a different path, because I'm sure we would have figured out that she's got a genetic mutation, which we're going to find out soon. Once we were to find out that she has a genetic mutation, it's very easy for me to get her to a specialized clinic that treats that mutation, connect her to the foundation, which is a bunch of parents also dealing with that mutation. And even some of the pharma companies who are trialing new products, they're all on the floor, and they're all my friends, and they're all my sponsors and resources. So I like to connect the dots and make people get to where they need to be without taking the long and windy road. I create a superhighway.
Because it's that easy. It's just that easy. If you
the doctors, again, I'm so lucky. I'm blessed. The doctors trust us, and they know that once you work with Brad and you come to the expo, be prepared for an onslaught of referral. And I'm not easy. I'm not an MD. I can't just send people to major hospitals without being an MD. It's very hard to refer in to a building, but I think they know that I know what I'm talking about. So when I say this kid is just not getting a fair look, her doctor is missing so much. She needs a whole new set of eyes. We need to start over, basically. She needs to be looked at as if she has never had any treatment. And I'll get her a new EEG before she comes to you. Just let me know if you want a 48-hour or 72-hour. And by the time you see her, we'll already have a new EEG report on your desk. And so the younger guys are getting very interested in that. And we're feeding them the referral.
No, it's great. Justin, I think just for time, we need to unfortunately end this conversation, but it's.
I think we won't end it. We'll just put it on pause and pick it up in a month when we get to hang out with each other.
That's true. Yeah.
Oh, are you coming, Justin, in November?
I am. Yep.
Awesome.
Yeah.
And what are you going to do there? Are you going to be talking to families and?
I'll be there in support. We have a video crew coming to do some interviews with some of the families, talk to some of the experts. So
amazing.
So really put this out there. TMA's mission, this aligns so perfectly with everything that we're doing and Josh has created. It just, we're fortunate to be on that super highway that you've been able to create. So it's a really neat opportunity. So I'll be out there to support.
Very cool. I'm excited to meet you guys then finally.
Yeah.
Great.
Monday afternoon. Come say hi.
Yeah.
Absolutely.
Well, Brad, thank you so much for sharing all about Epilepsy Awareness Day and all that you have done. Your journey is incredible. I think we could probably make this 2 or 3 more episodes if you'd like. Maybe do a recap.
After I get some rest and some sleep. I'm exhausted. I got 3 hours sleep last night. I was just trying to wrap up my scheduling, and it's amazing that doctors get emails at 1:00 in the morning and they respond.
Yeah.
And then I have to respond, so they know I'm not sleeping on the job. So
right.
It's
exactly.
Yeah. Well, for all of those that are listening, go to epilepsyawarenessday.org and get more information on the event at Disney. We're really excited to have Brad Levy on. Josh, as always, thanks for joining us.
No, it's so fun. It's so fun. Brad, thanks so much for making the time.
Thank you, guys. Thank you.
Yeah.
Talk soon.
Right. Until next.
Bye, guys.
Take care.